Hello, I'm Dr. Sandra Cabot. Welcome to my webinars where I share information to give you knowledge and clarity to enhance your health and well-being. I've been a medical doctor for over 50 years and I know that knowledge is power. So let's go. Hello everyone, great to be with you today. And hello Igor, my co-host. Igor Pershin, who is a mindset coach, helping us to obtain and retain a positive mindset and belief in ourselves. And today's topic is really interesting, Igor, and we've been planning it for a few weeks. And that is, can you be nutrient deficient even if you have a so-called healthy diet or a perfect diet? And let me tell you, you definitely can be very deficient in micronutrients even if you have a good diet. And some people think they have a perfect diet, but really, what is a perfect diet? What do you think a perfect diet is, Igor?
That's a good question. Something I've been grappling with for a long time. I've tried a lot of different diets over the years. Was vegetarian for a couple of years and ended up being B12 deficient, had a few other issues. So then then through the process of dealing with my own sort of chronic health conditions, I tried a low carb keto diet, which was great. Actually, that was like one where I really felt just had more energy. But it was a bit hard to keep up, especially just to be strict on it. So now I've kind of settled into like a low carb whole food diet, which after reading a lot of books about it, I think at the end of the day, whatever we eat, as long as it's as close to its original form of like whole food and nutritionally dense as possible, then I think that's a pretty good diet.
Yeah, that's an excellent start because hopefully you'll get most of the nutrients you need from your diet. But we'll talk about some of the reasons why you can have a so-called healthy diet but still be deficient in micronutrients. Now, for people who've joined our live stream, we love to get your comments. So feel free to let us know your thoughts on what your diet could be lacking or what are the most important and critical nutrient deficiencies. In my medical clinic in Sydney, I work with other doctors and naturopaths. We test a lot of people for deficiencies of vitamins and minerals. And it really is quite surprising to see that people who are so-called well-nourished, perhaps even overfed, have critical nutrient deficiencies. And the most common nutrient deficiencies we see are magnesium, the mineral magnesium, the mineral iodine, the mineral zinc, and also low vitamin D. And a lot of people don't test for these things on a regular basis, but it is really important if you're not feeling well, and even really if you just want to prevent chronic diseases and slow down the aging process, to have these things tested every 12 months. Iodine deficiency is a really interesting one, Igor, because people who don't eat a lot of seaweed are often iodine deficient. And you have to test for iodine with a urine test. So we don't check it in the blood. It's a water-soluble mineral. And if your iodine concentration in your urine is low, in particular less than 20, then you have severe iodine deficiency. But ideally, you would have an iodine concentration in your urine of over 100. And iodine is so important in people of all ages, right? In children, it's critically important for brain development, IQ, particularly in children who have a bit of autism, but just in the average child, who wants to do well at school, it's critical that they're not iodine deficient. And then in people of all ages, well, what would iodine deficiency cause? It could lead to a sluggish thyroid. It could lead to a weakened immune system and more frequent infections, and it could lead to a foggy brain. So obviously you don't want to be low in iodine. Now we have a comment here from Ginger and Garlic. That's an interesting name. That's probably the name of somebody's website, Ginger and Garlic. And they say they can't handle magnesium. Well, some people do get a little bit of diarrhea or loose stools if they take a magnesium supplement. And that means that they could be taking the wrong type of magnesium. You don't want to take magnesium oxide because it's not well absorbed from the gut and will act as a laxative. So you want to take well-absorbed forms of magnesium. I prefer magnesium powder. And you can just start with a really small dose, like a quarter of a teaspoon. So, for example, if you're taking magnesium ultra potent, which has got 4 types of well-absorbed magnesium in it, just start with a quarter of a teaspoon, see how you go. But everybody's different. Some people only need 100 milligrams a day of magnesium as a supplement. Some people need 400. Some people need 600. So start low and go slow. It's a very safe mineral. The only thing that could happen if you take too much is you get a bit of looseness in the stool. But that's more commonly caused by the wrong type of magnesium. And you don't want to be deficient in magnesium. And we see a lot of people, Igor, who have symptoms of magnesium deficiency. And they could be, muscle tension, anxiety, insomnia, cramps, premenstrual syndrome, menstrual pain, anxiety, osteoporosis. Magnesium is very, very important for your bone density. So without magnesium, you can't activate vitamin D. So you can get really quite bad osteoporosis from being deficient in magnesium as well as being deficient in vitamin D.
So
And
what would be, I was just going to say, what in a healthy diet, what would be the main sources of magnesium, and why would most people not get enough of it?
Yeah, well, magnesium is mostly found in dark green leafy things. But today we have a mass production of food. Food is kept in storage when it's transported. Also, if people have the wrong gut bacteria or a leaky gut, they may not be absorbing enough magnesium from their diet. And you may not know you're magnesium deficient because a blood test is not that accurate for magnesium. 80% of the magnesium in your body is found in your bones. So it's very, very important for strong bones. It's a very heavy, dense mineral. It gives your bones strength. So if most of the magnesium in your body is found inside your bones and inside your cells, what we measure in the serum in a blood test, it does not accurately reflect your total body magnesium amount or status. So it's really wise to take magnesium if you have any of the symptoms of magnesium deficiency. So I would give somebody with anxiety, insomnia, aches and pains, fibromyalgia, migraines, premenstrual cramps, even constipation, I would give them a magnesium supplement. And you'll see the difference within a week. It works quickly. It's a critical mineral. So, even if you have what you think is a perfect diet, you could be deficient in magnesium as well as other critical minerals. And, magnesium is really interesting in that it's protective against heart disease. And we know that magnesium supplementation reduces the risk of sudden death caused by a heart attack or an arrhythmia, such as ventricular tachycardia. So, we're talking about things that can prolong your lifespan here, which is really good. I mean, we know there's drugs that can do that, but, minerals and vitamins are critical too for increasing lifespan and preventing chronic disease, which is really an epidemic problem now in society.
So how would you know if, I guess if the tests aren't accurate, you would really know if you're deficient if you exhibit some of those symptoms, right?
Correct. With magnesium, if you've got the symptoms of magnesium deficiency, you're magnesium deficient for sure. Whereas with iodine, we can measure it accurately in a urine test. And that will tell you whether you need to take iodine. So a good source of iodine would be different seaweeds or kelp powder, and another source would be supplements that contain iodine. And remember that the recommended daily allowance is only just enough to prevent disease. It's not always enough to optimize health. And the RDA of vitamins and minerals was created in the 1940s during World War II. And life was different then, we didn't have so many pesticides in the soil. We didn't have so many nutrient deficient soils. We didn't have so many people taking medications, which can reduce nutrient absorption. And we didn't have so many people taking antibiotics, which can disturb the gut microbiome, which can also reduce nutrient absorption. Yeah, so
a lot has changed. Yeah, I remember when I was studying functional medicine, that, and Mike Hyman talks a lot about this. The IDA for most vitamins and minerals is far lower than what is ideally like a healthy range. Do you have any resources about like what is the healthy range?
Yeah, well, we can do another live stream on that, but the healthy range is always depicted in a pathology test from whatever path lab you go to. But remember, the healthy range is a bell curve. So 95% of people will fall into that bell curve. But you want to be optimal. You want to be in the middle. Whereas a lot of doctors will say to people, well, you're still in the normal range. You might be towards the bottom of the normal range, but you're just in there. Or you might be right at the top of the normal range, which can be good in certain circumstances. And this is where getting professional advice is good. But a lot of people get confused because, for example, the normal range of vitamin D is 65 to 300. That's a big bell curve, right? Yeah. So in somebody with osteoporosis, low bone density, or fibromyalgia, or cancer, or an autoimmune disorder, you don't want to be just in the normal range. You want to be optimal, at least 100, and maybe you want to be 150, because it depends on the lab, but the normal range of some labs is only up to 150. In other labs, it may be up to 300. And remember, if you're magnesium deficient, you won't activate vitamin D either. So these nutrients work synergistically together. So it's good to get advice, but it's far more dangerous to be low in these critical nutrients than it is to take a little bit extra. But, always be guided by your doctor or your naturopath. But vitamin D can be used as a therapeutic tool. I often say that vitamins and minerals we use as natural drugs, as therapeutic tools, because we can often resolve the symptoms of diseases by using slightly higher doses of specific nutrients. Now, let's look at another nutrient that is often deficient in people, particularly in Australia, and that is the mineral selenium. Now, I've been studying selenium for 40 years, and this is a mineral that's fascinating because it protects our cells from damage from free radicals and viruses. I call it the great protector. Now, blood tests for selenium are not accurate because the vast majority of selenium is found inside our cells. So if you have a blood test for selenium, it's not going to accurately reflect the total body amount of selenium. You have to have a tissue biopsy, and that's too expensive. So you need to be aware, well, what are the symptoms of selenium deficiency? So some tests will have limitations, and you need to go by the symptoms. And if you are having a blood test for selenium, it's important to stop taking your selenium supplement for 5 days before you have the blood test, because the blood test is only going to tell you if you're absorbing the supplement, and it'll stay in your blood, but then it'll quickly be accumulated by the nucleus of your cell where it's stored to protect your DNA. So a common mineral deficiency. Now we have another comment there, and that's from Fiona. Hi, Fiona, and she's in Scotland.
Hello, hello, Scotland.
Scotland, yeah, and she started a whole food eating regime and has felt the benefit already in that the top of her stomach doesn't feel so bloated, and she also has gallstones which reacted to her previously bad diet. Yes, gallstones don't like a high-carb diet. They don't like processed food. If you've got gallstones, you need a whole food diet, and we have a really good book on healing your gallbladder naturally, and also how to save your gallbladder and what to do after you've lost it. But one thing that can help your liver to make a healthy bile is having a healthy diet, because your liver's making all the bile, and it needs protein and it needs the healthy fats to make the bile. So thanks for that comment, Fiona. Yeah. And, that's another reason why people can be deficient in nutrients, is because they're lacking bile. So as we get older, our liver gets less efficient, may not produce enough bile, or if we have a dysfunctional gallbladder which doesn't contract properly, and we can test that with a scan, or if we've lost our gallbladder and when we eat we don't get the spurt of bile that we need to digest and absorb fats. So a lot of people have a gallbladder problem that could be undiagnosed, so they're not producing optimal amounts of bile, and so they don't break down the fats in the mill, and they don't absorb them. They also do not absorb the fat-soluble vitamins. So even if they have a healthy diet, they're not going to be absorbing the fat-soluble vitamins, vitamin D, vitamin E, vitamin A, and vitamin K. So they could get osteoporosis. So this is why we're saying, well, even if you think you have a nutrient-dense diet, you still may be deficient in these nutrients because your gut can't extract the beneficial vitamins and minerals, which are the micronutrients, from the food, and your gut cannot extract the macronutrients like the protein and the carbohydrate and the fats. So there's so many factors that can cause nutrient deficiencies, even in people who think they have a healthy diet. And we see this a lot in our clinic because, we're testing people for iodine, vitamin D. I don't bother testing people for magnesium because it's not really an accurate test. Yeah, so
I was just going to mention, so something something I learned through my own sort of health journey when I used to live in Melbourne was that for certain times of the year, or for most of the year actually, we don't actually get enough vitamin D, even if we're out in the sun, just because of the angle of the sun. It's not as direct as if you were living in the equator or closer to the equator. So yeah, that's something that I think people need to be conscious of if they're living in a place that's a bit cooler and they're not getting enough vitamin D. It's something that we definitely need to supplement, especially during the winter months.
Yes, especially during the winter. It's so important for children too, because it reduces the risk of severe viral infections. There's a lot of children who are always coming down with recurrent viruses, and they're often on antibiotics for the secondary infection. But are they low in vitamin D? Because when you put sunblock on your skin, that stops your skin from turning cholesterol into vitamin D. So sunblock, it can cause vitamin D deficiency, and then you will need to supplement with vitamin D. So it's good to get some sun
Ironically,
at a safe time, not necessarily the midday sun unless it's winter, but at 10 a.m. or 3 p.m., 4 p.m. Without some sunblock, so your skin can make the vitamin D, right?
do the natural sunblocks work better, or not really any difference?
All sunblocks will reduce the conversion of the cholesterol into vitamin D in your skin. Yeah. And thankfully, vitamin D supplements are inexpensive. And you've got to take vitamin D with food because it's a fat-soluble vitamin. Yeah. So, I'm always interested in patients with chronic inflammation, how they can reduce the inflammation with specific vitamins and minerals. And let's look at selenium, which is very deficient in Australian soils and also in large parts of China. And they did a really good study in China with nearly 40,000 people, and they supplemented people with hepatitis B virus with 200 micrograms. It's a small amount. We only need micrograms every day. And they compared them to another group with hepatitis B, and they didn't supplement them. And they found that over 5 years, the incidence of liver cancer reduced by over 40%. So that's dramatic. So we know that, viruses can cause cancer. So when we're talking about vitamins and minerals, we don't realize that they can save our life. They can add many, many years to our life. I see a lot of patients with the human papillomavirus, and they get mouth cancer, tongue cancer, tonsillar cancer, what we call oral cancer, and it's caused by the human papillomavirus. Now, for a virus to cause that type of damage, it's got to damage the DNA in the cells, and then they mutate into a cancer cell. So we're talking about a critical nutrient that can be hard to measure in your body. But if you know you live in an area that is selenium deficient, such as Western Australia, South Australia, a lot of parts of New Zealand, parts of China, and because the planet's overpopulated now, there's probably many more areas that are selenium deficient. I think it's wise to take a selenium supplement. People say, well, I'll have one Brazil nut a day. But how do you know that the soil where the Brazil nut tree was grown was plentiful in selenium? There's so many factors. But a lot of people don't realize that, critical nutrient deficiencies can cause cancer. They can exacerbate autoimmune disease. They can cause a infection to be far more serious. Like, look at COVID. The mortality rate for COVID was much higher in people who were vitamin D deficient. And so they finally realized, hey, we've got to really recommend people take vitamin D. and fairly high doses, 5 or 10,000 units a day to get your level up quickly. Because, if you're living in a high latitudes, well, you're not going to be getting enough vitamin D. So, yeah, it's really interesting how we can use these specific nutrients as therapeutic tools to
and also,
lifespan.
I was just going to mention, it's also something that people need to consider is the absorption. From what I understand, the absorption of vitamin D. So how much vitamin D you require is also a factor of how much melanin you have in your skin. So my stepson, for example, his father's from PNG, so it's of my wife, his mother. So yeah, his dad's darker skin, so he's much darker. He needs to get out in the sun much more than say I do, and
Right.
so that's something that we need to consider as well.
Yeah, interesting. And, let's look at dementia and even foggy brain, where your memory is not what it used to be. We know that neurotransmitter production is highly dependent on micronutrients, in particular, activated folic acid. So you can have a blood test to check your folate, and that's quite accurate. But once again, you don't want to be just at the bottom of the normal range. You want it to be high, because having plenty of activated folate in your body will help your brain to make critical neurotransmitters that will protect your brain and also improve your memory. So we want to make lots of acetylcholine. We want to make lots of serotonin, dopamine, endorphins for our mood. And to do that, we need a lot of activated folic acid. Now, some people don't like eating a lot of green leafy vegetables, right? Particularly men, I've found. So it is good to take a supplement of activated folic acid. So how do you know if you're low in folic acid? Well, you can have a blood test, but you can also check one of the metabolic byproducts of poor methylation, which is a process that enables your brain to make neurotransmitters. So you can have a test for a marker in your blood called homocysteine. Have you heard of homocysteine, Igor?
I have heard of it. I can't remember what it does.
Yeah. Well, homocysteine doesn't do much. You don't want too much of it. It builds up in your blood if you're not methylating properly. And if you're not methylating properly, it means you're not making enough neurotransmitters. So you could suffer with depression, anxiety, foggy brain. And if you stay deficient and with a high level of homocysteine and deficient folic acid, your risk of dementia goes up a lot. So we know that dementia is now the second leading cause of death in older women. And this is new. It never used to be like that. And I think it's because, we're not eating enough green leafy stuff. And if you don't like eating green leafy salads and things, it takes a lot of chewing. You can juice. You can make yourself juices with green leafy things and add some carrot and beetroot, whatever. And that's also got a lot of folate. And you can sprout broccoli seeds and eat a handful of those every day. So that's a good way to boost your activated folate. And Igor, I was just going to say we should put our banner down the bottom too.
Yes.
Yeah.
I was going to do it at the end, but yeah, we can do it again.
We haven't been doing this for very long, folks, so we're still a little bit clunky, but we'll get better at it.
Sorry to the folks. I was just going to say sorry to the folks on Facebook. Our Facebook link broke, so that's why I posted the YouTube link. But hopefully those people saw it. Yeah.
Yeah. Now we've got a question from Fiona Donaldson. Should you take vitamin K with vitamin D? Yeah, you can. I mean, it's not mandatory, but vitamin K is found in green leafy vegetables, but you've got to convert it to the active form. You can eat liver. That's a fantastic source of vitamin K. But there's a lot of supplements with vitamin K and vitamin D now, which is great. We've got the super vitamin K supplement, which has got 2,200 micrograms of vitamin K and 2,000 international units of vitamin D in one capsule. But of course, vitamin K and vitamin D is so critical if you do have low bone density, and also, for your whole nervous system, really. So it's a good idea to do that, Fiona. Yeah, so the other nutrient that's critically important for your whole nervous system and also for methylation, which is a process where you make the neurotransmitters, is vitamin B12 or cobalamin. And we get that in meat and eggs, anything that comes from animal sources like dairy, eggs, seafood, meat. So vegans can be deficient in B12, and it's very important that they do take a supplement. And it's very important if you have a foggy brain or if you just don't feel well, you're tired, to have a blood test for your B12, your total B12 and your active B12. That's very accurate. Now, B12 deficiency is quite common because if you have the wrong gut bacteria, that can reduce your production and absorption of B12. And if you have a lack of stomach acid, or if you have an inflamed stomach, you may not absorb B12. And there's an autoimmune disease which attacks the lining of the stomach, and it stops the absorption of B12 completely, and that will show up in a blood test. And then you must have an injection of B12 every 3 months. Otherwise, you can get severe inflammation and even degeneration of your nervous system and greatly increased risk of dementia. So that's a critical vitamin. Yeah.
And I think I was just going to mention something I remember when I was vegetarian. Yeah, I had to inject vitamin B12, and it's my doctor at the time told me that if I have too much, you just urinate the rest out, right? The excess. So that's something we haven't really talked about is what are some vitamins that if we have too much of, that it can pose a risk, or are they? Does our body mostly just get rid of whatever excess it doesn't need?
Well, everyone's an individual, and what one person needs doesn't necessarily match what another person will need. You've got to take into account the individual hormonal metabolic characteristics of each patient. But in general, nutritional medicine is very, very safe. I've been doing it for 50 years and I haven't seen any severe adverse reactions. You can have a problem with B6 if you take too much. It can cause a peripheral neuropathy, but that's reversible. So you don't need to take mega doses. Like some vitamin B complexes are very strong. And I often say to people, well, you only need it twice a week. Otherwise, you'll just have really bright coloured orange urine. And, you're kind of wasting your money. And generally, people don't get low in B vitamins unless they've got a problem with their stomach acid, or they could have had a gastric sleeve. Bariatric weight loss surgery can cause deficiencies, or they're on medications which could block the absorption of some B vitamins, such as acid blocking drugs like proton pump inhibitors. They can really reduce the absorption of many critical nutrients. And people take them for years and don't realize that. So it's a good idea maybe to have a break from them and take your supplements during those few days that you're not on them. By the way, our banner's still not showing.
Oh, it was showing. I just took it down for a minute. Did you want me to keep going throughout the?
Yeah, I think so. Yeah.
Okay, sure. Yep.
So B6 could be problematic. Selenium, well, once again, you don't need mega doses. I mean, if you have someone with a serious medical problem, such as a severe autoimmune disease, then they may need to take 400 micrograms a day for 1 or 2 months to get their autoantibodies down. But long term, you don't really need more than 150 micrograms a day. But it's recommended that the upper limit of safety is about 700 micrograms, but you really wouldn't want to take any more than 200 micrograms a day. But that can help people who have autoimmune problems or chronic viral infections. You know, some people get an infection with glandular fever, the Epstein-Barr virus, or the herpes virus, or COVID, or RSV virus, cytomegalovirus. All of us have many viruses in our body, but it's only if they multiply too much and the total amount of viral load goes up that we will get damage to our cells. So selenium can reduce that viral load. So if somebody's got post-viral syndrome where they've got the chronic fatigue, they never recover after an infection with one of these viruses, they would need to take 200 micrograms a day, and they might need to do that for 4 to 6 months. And when they're starting to feel better and getting their health back, they could drop down to a maintenance dose of even 100, 150 micrograms a day. And if you're living in selenium deficient areas, or you have a particular medical problem that requires a higher dose, then you could stay on 150 to 200 micrograms a day. So it can be individualized. And of course, people can always send us an email. You know, go to liverdoctor.com and send us an email, because we love to get your emails and we will answer those questions. Now, another nutrient, yeah, go ahead.
I was just going to ask something that I haven't really delved into this research enough, and you probably know a lot more about it than I do, is around, so once you start consuming nuts, like nuts are a great sort of source of B3, is it B3? Yeah, B3
Yeah.
vitamin and many other nutrients. But something that I was reading, that if we don't like activate them by soaking them or by activated nuts, then they contain phytic acid, which can be a vitamin or nutrient blocker. Is that correct?
Yeah. In some people, yes. You know,
Okay.
we find in grains and legumes and some nuts we find phytates and also lectins, and they can be inflammatory to the gut in some people, and they can also be nutrient blockers. So some people are better off not to eat foods that contain phytates. And it's trial and error. You know, some people have a gut that's almost bulletproof and you know, they can eat gluten, they can eat grains, they can eat legumes, and other people are really very intolerant to gluten or phytates and lectins. And if you do have gut problems, it's good to go on an elimination diet and be your own case history, you know, do a clinical trial on your own body and just eat a very restricted diet of, say, just meat and green vegetables, and do that for a couple of weeks, and then start introducing one food at a time and see how you go. But yeah, it is good to activate nuts if you do have a sensitive gut. I think that's you know, well established now that it does help. Yeah.
Mm-hmm.
By soaking them.
Good to know.
Yeah. Yeah. Okay. Now, another nutrient deficiency that is important is choline, and that can be deficient in people who are strict vegans. And choline is very important for your brain to make acetylcholine, which is the neurotransmitter for memory and cognition. So I would highly recommend you eat eggs regularly to get choline, but you can also get choline if you eat organ meats, or also, you know, in dairy products. So that is something to be aware of. And, that may help your memory a lot. I have a lot of patients who suffer with the foggy brain, and nutrient deficiencies can be a very common factor in this, particularly if they're low in choline, they're low in iodine, they're low in B12, or they're low in activated folate. I had a patient years ago. She was really interesting. She was an old lady in her 80s, and she came to me and she said, "I can't remember anything, Dr. Cabot. I must be getting Alzheimer's. I can't remember a thing. What can I do?" And she had a really terrible diet, which a lot of old people do, because maybe they don't have good teeth, they may be lacking bile, digestive enzymes, all sorts of factors. And I said, well, let's get you juicing all the raw veggies, the green leafies, some beetroot, all the different colours of the rainbow will get you juicing. And so her daughter helped her do that. And she came back 2 months later and she said, my memory's fantastic. It's better than what it was in my 40s. Thank you, Dr. Cabot, because she was obviously severely deficient in activated folate. So these critical nutrients are very important when it comes to our brain being able to produce neurotransmitters. And, a lot of people out there with depression and anxiety, they are on an antidepressant drug, which may be helping them, but it's not helping their brain to make more of their own neurotransmitters, right? It's helping to retain the neurotransmitters for longer between the synapses, but it's not increasing the brain's production of neurotransmitters. That's what we need if we have depression and anxiety. So we can do that just by having a nutrient-dense diet, by taking a magnesium supplement, by ensuring that we're not low in iodine, and by looking at the fat content of our diet. There are some integrative psychiatrists now that are on YouTube, and they talk about how they use a very high-fat ketogenic diet for people with severe anxiety, severe depression, and even psychotic illness. And they get tremendous results. The anxiety goes away, the insomnia goes away, the depression goes away. And then if the patient is not compliant and goes back on all the high-carb foods, all their symptoms come back. And this is even if they're on medication or if they're not on medication. So we know that deficiency of the critical fats is very important for every cell in your body. Every cell is surrounded by a membrane. Every mitochondria is surrounded by a membrane. And those membranes are made of fat. And if they're made of the wrong fats, you won't make energy. You'll be very, very tired. And your brain won't make neurotransmitters. So, that didn't surprise me when these psychiatrists were talking about the dramatic success they get in patients with chronic mental illness and chronic emotional disorders just by putting them on a keto diet. It's profoundly powerful. Yeah.
That's interesting. Yeah, I've been reading a book about ADHD because I've got I'm working with some new clients who have ADHD, and one of the aspects of diet that came out was actually that a high protein breakfast can really help reduce anxiety and actually mitigate some of the aspects of ADHD, at least in the short term, which is interesting.
That's right. Yeah, high protein breakfast, meat, eggs, some good fat, avocado, definitely some coffee with some coconut cream in it to give you the MCT oils. So many people are eating the wrong fats because they're eating processed food. So they're getting plant-based vegetable oils, which are processed. So the oils are extracted from the seeds and the plants using high temperatures, solvents, and that damages fats. So they're getting all this processed omega-6 fat. I call it plastic fat. And it gets in our cell membranes and it stops the cell membranes from working. So that's going to disturb all the electrical activity that's happening in your cells. So we want the natural unprocessed fats that come from avocados, eggs, coconut oil, and animal products, cheese, all those great foods that taste so much better, actually. And if you're trying to lose weight, it's really helpful because the protein in the fat is very satiating, and it's going to keep your insulin low and give you stable blood sugar so you don't get the cravings, and that'll help you lose weight.
Yeah, those industrial seed oils are hard to get away from. They seem to be like every time you go to a restaurant, they often cook with those things. Every now and then I'll indulge a little cheat meal, like a little bit of chips. I do eat healthy like most of the time, but every now and then. And they're doused in seed oil. So I've been trying to find ones that are made using olive oil. I actually I love a coffee in the morning, and I can't handle dairy, and I've actually finally found a non-dairy milk that is actually made with olive oil, which is great. There's an Australian mob called Oats My Goodness, like it's just got OMG on it, which is pretty cool. And Australian oats and Australian olive oil. So it's good that people are starting to wake up to that. I think we really need to really cut out and avoid industrial seed oils. They used to actually be used as industrial solvents before they were applied to food.
Yes, that's right. Yeah, and margarine and all that processed plant-based spreads. It's better to have butter or ghee, and it tastes so nice. So you're getting the healthy fats in that. So I think we've probably covered everything there. We don't have any more comments, but
we do have a few.
Oh, we do? Okay.
So ginger, I'll just go through each one. I think so V mentioned this one. Taking magnesium glycinate 400 milligrams a day divided stopped my
ocular migraine.
Migraine. Okay.
Well, I'm not surprised. There's studies that show that magnesium, if it's taken regularly, can reduce the frequency and severity of migraine. And what's important is how much elemental magnesium you're taking. So you might be taking magnesium glycinate, but how much elemental are you getting? The 400 milligrams of pure elemental magnesium a day, because you'll get an even better result if you are. But magnesium is so important. And people who suffer with migraine, we call them migraineurs, which is a French word, and it's often inherited. I used to get migraines, and I never get them now because I'm addicted to magnesium. I love magnesium. It got rid of my migraines too, V. And you think about a migraine, it's quite dangerous, and it causes a restriction of blood flow to the brain. And we know that severe migraine sufferers have an increased risk of stroke. So magnesium has a protective effect against strokes, and also, as we mentioned before, against sudden cardiac death. So what a wonderful mineral. Mineral.
On the topic mineral. On the topic of magnesium, back when my wife, we used to have a spa at the previous place we rented, and we loved taking like a spa with what's it called, with magnesium salts. Is that another good way to absorb magnesium if you're taking like a spa with magnesium salts or a bath?
Well, you will absorb some, but you won't absorb as much as you will from taking an oral supplement. And powder is great in people who struggle with swallowing tablets or they don't absorb it that well. Here we have an interesting question. Someone who took selenium for her thyroid and said it made her hair fall out. That's ginger and garlic. Well, selenium won't make your hair fall out unless you took a huge dose, like 1,000 micrograms a day for many months. But thyroid problems are a common cause of hair loss, and most thyroid problems are autoimmune and associated with high autoantibodies, and selenium will help to lower that. So I've never seen selenium cause hair loss. So I would suggest that it would be, you should look into other reasons why you could have hair loss. So common causes of hair loss are hormonal imbalances in women, such as progesterone deficiency, autoimmune disease, which thyroid is. So you've got to get the antibodies down. And also the wrong bacteria in your scalp, the wrong microbiome in your scalp. So you could have like a fungal infection or bacterial infection in your scalp. So I would look into other causes there for your hair loss. But once again, you don't need mega doses of these things. Do you have any more comments?
What's this one? Drive me crazy daily, heavy woozy, head pressure, also not vertigo, and how much vitamin D should I take at AM 75?
Okay, so what is that one down the bottom? Can you read it out?
The one I just put, this one, or another one?
Yeah. Oh, the
It's
one
not
you,
really,
oh,
not
there
really.
we go. Yeah, I've got it. There's a long
Yeah.
list of, oh, Joanne, yeah.
Yeah, she was here last time.
Oh, great. Well, she's saying she gets a heavy woozy head, pressure in her head, also not vertigo. Okay. How much vitamin D? She's 75. Well, you really need a blood test, Joanne, to see what your level is. I mean, a woozy head, you're saying it's not vertigo, so, you know, things aren't spinning around like that. It's just like feeling off balance, right? It's very unpleasant. It's very dangerous because it predisposes to falling over. Well, this could be your blood pressure. It could be blockage in the carotid arteries, or, atherosclerosis in the cerebral arteries. So I would see a doctor and have an MRI scan of your brain and make sure you don't have atherosclerosis in your cerebral arteries. I would also check your blood sugar level. I would have an accurate blood test for vitamin D and see what the cause is. One thing I see, Igor, in older women is sodium deficiency and potassium deficiency. So a lot of people still think that salt is bad. We've been told, don't put salt on your food. Put your blood pressure
High
up.
blood pressure, yeah.
Yeah. If you have normal kidney function, that's not going to happen. So what happens if you have low salt in your blood, low sodium chloride, is you will feel dizzy and weak. So I would definitely have a blood test to check your sodium chloride level, and you may just need to add some good salt to your food, maybe add a bit of kelp powder also to give you other minerals, and kelp it's got a lot of sodium as well, so it's a great source of organic salt.
I'm wondering if I should start adding kelp or seaweed to my diet. Sounds like there's a lot of benefits.
Yes, definitely a good idea. Yes, because it's high in salt. It gives the food flavour. We're bringing out a kelp called smoky kelp. It's been dried on wood, and it's got this lovely smoky flavour, not too fishy, and you can add it to your salads or stews and whatever, and it's giving you a little bit of extra iodine and other minerals. Yeah. So
again,
what else?
The Japanese got it right. They're using it a lot in their cooking, and they've got some of the longest life expectancies in the world.
Yes. Well, these trace minerals are very important for your life expectancy. if you're low in selenium, you have a much higher risk of viral infections being fatal, and also a higher risk of cancer. Okay, we have a question from someone called Melt. Can I eat butter if I have gallstone and fatty liver? Yes, you can. What causes gallstones most commonly is people not eating enough fat, or people eating the wrong type of processed vegetable oils. Processed food is very bad for gallbladder, or eating deep fried food in vegetable oil, eating too much sugar. They're the things that cause gallstones. So, if you eat healthy fat like real butter and avocado, some coconut cream, some healthy meat with a little bit of fat on it, that's going to help your gallbladder to contract better. So you definitely can have the healthy, unprocessed fats. Yeah.
What if you, I love fried food, and I know it's not great for me, and I do indulge sometimes. What if I fry food in like a healthy fat, like coconut oil? Is that healthy?
Coconut oils. You can have stir fry.
Oh, yeah.
I'm talking about things that are deep fried, like battered fish and chips and things. They're deep fried, usually in cheap oils, so they're oxidized and they're inflammatory.
Well, what if I deep fry my own, say, like karaage chicken at home? Yeah.
A deep fried chicken?
Yeah, what if I deep fry my own karaage chicken at home in like a good oil? Is
coconut oil?
Is it the act of deep frying, or is it the oil that you use that is the bad thing?
Well, you don't want to burn the oil, not extreme high temperatures. But yeah, that would be much more acceptable than doing it in, the oils they use in fish and chip shops.
Yeah, it's terrible. And they keep reusing them as well.
Yeah, I know. And if you have a gallbladder problem, you'll find that you won't feel good afterwards if you do that. But stir fry's good. Stir fry's good. Olive oil, coconut oil. It's just you don't want to burn any oil because you'll oxidize it. Yeah.
Good to know. Yeah. We try and cook in coconut oil, although my wife's not a huge fan of the flavor, so she uses ghee, which is also
ghee's excellent. Yes. Well, I think we've probably covered everything there. Have we covered all the comments?
I think so, yeah. And that brings us up to pretty much an hour. So we will still post this on Facebook. I'll strip the video and upload it to Facebook. Sorry about the break in the stream. We'll try and get that fixed in time for our next stream.
Yeah. Okay, great. Well, our next stream will be posted on liverdoctor.com. And where else are you posting it, Igor?
Well, yeah, it will automatically post on the YouTube channel, and we'll post it on the Facebook, on your Facebook page as well.
Yeah, we have.
And I'll post it through my channels as well.
We have so many great topics we want to cover: menopause, progesterone, arthritis, autoimmune. So there's so much to cover. There's so many interesting topics that you'll love to know about that will really help you have a better quality of life. So thanks for joining us today, everyone, and thanks to Igor as well.
Thanks, Sandra, for sharing with us your wisdom.
Pleasure.
Thanks, everyone. All right, we'll wrap it up.
Well,